Galina Lesco. I am by my background doctor and also for many years specialization in adolescent medicine and also coordinate network of youth-friendly services here in Moldova. And I want to mention especially challenge to access services for adolescents in vulnerability. First of all, this can be adolescent from rural area where not exist all range of services and some rural setting even doesn't have a medical nurse. Not everywhere, but it's a big deficit of staff. This is one issue. Other issues, it's continue to be complicated for adolescents with disabilities, without parental supervision, because we have a lot of parents who live abroad for work and adolescents remain alone or with some relatives. Also we have LGBTQ community who also face many challenges, and this is continue to be a challenge, especially after the COVID lockdown, when it was more difficult to enter in many schools. Because we had a good cooperation with schools. Now we reinforce these connections, but not fully achieved again, and not all adolescents have access to knowledge what such kind of services exist and about some appropriate knowledge about their health and development. This is like a medical office on the road. Real medical office created to make first examination, testing, and etc. And it's in different districts, but almost all staff who work in center have a duty to go out in outreach with mobile clinic. And it's doctors, gynecologists, midwife, nurse, psychologists, social workers. Sometimes are only doctors, sometimes are combined psychologists and doctors or midwife, and it's a basic package of youth-friendly services started from rapid testing for HIV, for syphilis, for hemoglobin, for pregnancy, to provide contraceptive counseling and offer contraception and method and supplies to do anthropometry, some general exam, some basic counseling, and practically a basic package of services, not only this whole logistics related to this. And this year of piloting was especially to reach adolescents from rural area in Chișinău municipality in suburb, and also was used to reach refugee people too in refugee centers. And this was like a first contact, first entry point, because after first contact with Klinic for many of such young people was much simple to reach centers and to come in reach. If to refer to the example of interaction, I can share this example when our mobile team go in one of vocational school in suburb of Chișinău. It is a rural area, and there was a team doctor and nurse, and usually we have a technique to ask question about health, and a few questions was related to suicidal thought. Was few boys, 3 boys in this case, and doctors say this is not our competence, but you are very courageous that share this with me, but we have a solution. Look, we can call with you and check phone what it's 24 hours, and you can connect directly psychologist after the meeting. These boys, 2 of 3 called phone, support phone, and was real problem. First connection and counseling with psychologist was on phone. After they established a connection, second one for them was much easier to come to office and to have a good psychological support. And we can say that at least these 2 cases, they go out to big risk. And now at this moment and during this year we see increasing of problem with mental health. Of course was question related to sexuality, but appear few was 3 question on suicidal thought of participant, and they just write it, I have a thought to suicide and what you can do. And this case, it's one of the example when combination of all these 3 new services, help us to reach, and these two boys of 3 was really in risky situation, and we can say that this is one example when immediately in very short time was very effective to help them. These outreach services and mobile services and phone services, this is first contact. This is our helper and tool to make this connection to adolescent, for them to feel what services are more close to them and are here, and after it's possible to invite. In general, we look on our youth-friendly services, on our youth clinic, big open door for adolescent in health system, adapted to them very easily to open, and we create all these entry points to make this entrance in the system much easier and much smoother and friendly for adolescents. All our work in youth-friendly services and work staff that it's skilled, it's trained to work with adolescents, and even we learn by doing in mobile clinic because it's new experience. We learn, and from our experience, how to do it more accessible, and in this process adolescents help us very much themselves because we ask them, we consult them, and they give us idea for new location, for new ways. In some visit participate our volunteers, adolescent volunteers, when they go and have location place in some public place, because we have different location near the school, near the local authority, near the medical offices in rural area, but also in some public square periodically, and combine consultation with some informational or action, some message distribution, and such action I involve with our volunteers here. My hope for the future for these remote services or outreach services, mobile clinic and hotline, to be sustainable financing, to be as ordinary services, and for mobile clinic to have it in each youth clinic in each district, and to have a good connection, better connection between youth clinic and school health, because we have undeveloped these services, and this is another big hope to develop them much more. To be this mobile clinic not like a separate service, and to have a good connection with existing services, and initially to have youth-friendly services, and after will be much easier to have this service additional added value to existing services. Maybe in some condition could be separate mobile clinic like in a humanitarian setting, but in this case it's need to have a very good referral framework. This is one, and second one, to have a good equipment and needed logistics and needed financial support.